How does diabetes genetics affect your family? Imagine a family gathering where conversations about health suddenly turn to a shared history of diabetes. You might wonder how much of that risk is written in your genes. Genetics play a big role in determining who might develop different types of diabetes. These inherited variations can influence how your body produces insulin, how it responds to insulin, or how your immune system functions. There are several types of diabetes with genetic links. Type 1 diabetes is an autoimmune disease where the immune system attacks insulin-producing cells in the pancreas. Certain gene variations, especially in the human leukocyte antigen gene complex on chromosome 6, can increase this risk. Even if no one in your family has type 1 diabetes, siblings or children of someone with it are more likely to develop it. The inheritance pattern is complex, but having family members with it does raise your chances. Type 2 diabetes is the most common form and involves the body's resistance to insulin and sometimes reduced insulin production. Many small genetic variations have been linked to increased risk. These variations work together with lifestyle factors like diet, weight, and activity levels. If a parent or sibling has type 2 diabetes, your risk is about 3 times higher. And like type 1, it doesn't follow a clear inheritance pattern but results from a mix of genes and lifestyle. Maturity onset diabetes of the young is a rarer type caused by a mutation in a single gene. This gene affects how your body secretes insulin. It is inherited in an autosomal dominant way, meaning if one parent carries the faulty gene, there's a 50% chance their child will inherit it. This form usually appears before age 25 and has different features from other types. Gestational diabetes happens during pregnancy, but it can also run in families. Women with a family history of diabetes are more likely to develop it. Babies born to mothers with gestational diabetes have a higher chance of developing diabetes later in life. Understanding these genetic factors helps families assess their risk. Genetic testing can identify if someone carries high-risk gene variants, especially for type 1 and maturity onset diabetes of the young. If a family member tests positive, they can be monitored more closely for early signs. Making lifestyle changes like eating healthier, staying active, and maintaining a healthy weight can lower the chances of developing type 2 diabetes. Knowing your family history and genetic predispositions also helps with planning for the future. It gives you a clearer picture of your chances of passing on these genes to children. In the end, understanding how genetics influence diabetes can guide you toward better health choices and early detection, making a real difference in managing hereditary risk.